Imagine you have cancer, and there's also lots of cancer in your family. Your healthcare provider orders you genetic tests. The results come back negative, in this case meaning the labs your healthcare provider used didn't find any genetic variants or mutations that explain your family's cancer or that are treatable markers for your current cancer. You pause and ask your doctor, are you sure the test didn't find anything? Could the labs have missed something? The short answer is yes, the labs could have missed something. And some labs are missing more than others, but many labs don't do what is necessary to find out what they're missing. Today, we will be discussing the process labs use to determine how accurate their genetic tests are before they get used on patient samples. This is referred to as proficiency testing. Dr. John Pfeifer, MD, PhD at Washington University School of Medicine in St. Louis, is a specialist in these kinds of proficiency tests.
Proficiency testing at the end of the day is the external mechanism that various regulatory agencies and payers as well, insurance companies use to ensure that laboratories, if they do a test, are getting an accurate test result. Who should care about it is virtually everybody who has personally or has a relative or someone that they know who has a disease, whether it's inherited or whether it is cancer, for that patient for whom a specimen has been submitted for next generation sequencing analysis.
Dr. Pfeifer will explain why this topic matters.
What you don't know can hurt you. And that's the issue here. There's also that statement out there that ignorance is bliss. Well, ignorance is bliss unless it actually has to do with your healthcare, right? I don't know of any clinical labs that are running patient specimens with the idea that they have problems in their bioinformatics tools, they have problems with their tests, and they just don't care, right? That's not ethical, and laboratories do the best they can. But ignorance isn't always bliss, and what you don't know can hurt you.
Dr. Pfeifer explains some of the limitations of using only traditional real samples, known as wet samples, to measure the accuracy or proficiency of genetic tests.
The problem with a wet sample, a group of 50 cell lines that has been manufactured, is once a laboratory uses those, they know the answer. Okay, so you're back in high school, right? You go in and you're in your algebra test or your trigonometry test, and the teacher gives you a test and there's 10 questions and you don't do so well, okay? So then the teacher says, well, you're gonna have to study a little more and take it again. Well, you go in the next time and you know going in the next time that it's going to be exactly the same 10 questions, right? That's the problem with these cell lines that have been produced. They're great cell lines, they have high utility, but once they've been used once, believe me, the NGS community knows what variants are there. And so they're no longer blinded specimens. You can't use them a second time, right? Now, yeah, if there's cell lines, you might be able to mix them, but you know the variants. If you are a clinical laboratory, you know the variants to look for, and you can set your bioinformatics pipeline to actually trigger or focus on those particular variants. That's a problem with design wet samples. People spend lots of time and money developing these cell lines, and they are incredibly useful once. And then they're not available to be used in a blinded fashion anymore.
Dr. Pfeifer talks about how computerized methods called in silico can help solve these problems.
So one of the things that in silico enables you to do essentially is this iterative process, much faster, much more inexpensive, much more comprehensively, so that quality testing can improve, right? Laboratories do not design bad tests that have low clinical utility, low accuracy on purpose. All laboratories, if they're CLIA licensed, are performing high quality testing for the samples that they've analyzed. The problem is what you don't know can hurt you.
We also discuss why nearly all labs score very highly on current proficiency tests, masking the true problem.
One way you can get a high level of accuracy is to give easy variants. And if you go and dig in the data, the variants have been pretty plain vanilla. There are occasional variants which labs don't do very well on, but those have not been well represented in these proficiency challenges, okay? The proficiency testing that CAP to date has performed, the challenges that they offer, have avoided variants which they know laboratories have trouble with. Now, there's an explanation for that, and that is you have to walk before you run. That the approach, CAP's approach, has been, let's test laboratories on the simple variants, and then we'll move on to the more complex variants. I'm not sure I personally agree with that approach. If this is a class of variants that is regularly encountered in routine clinical practice, I think you have to challenge labs on it.
Finally, Dr. Pfeifer addresses how we need to raise the tide when it comes to testing the accuracy of genetic testing and the importance of this process as genetic testing evolves over time.
So when you think about these limitation of wet samples, when you think about all the bioinformatics that are designed around each one of those assay types, we're going to have to do more rather than less in order to make sure that the accuracy of next generation sequencing is actually supporting patient care, is actually giving results that can be used to improve patient care.
Please follow the links to freely listen or view the full podcast presented by the Center for Genomic Interpretation, a 501c3 nonprofit organization that works with precision medicine stakeholders to help them realize value and improve patient safety in clinical genetics, genomics, and precision medicine.